So thank you all so much for joining us. We really appreciate it, and we're really excited to be here to talk to you all today about promoting mental health in the workplace during COVID-19 and practicing acceptance and mindfulness. We're really thrilled to be doing this work, and we partnered with Dr. Nicole Andreoli, who will introduce herself in a bit. But we're very excited to have everyone here from near and far, and really look forward to sharing some of what we've learned and what we've seen during this time and hearing from you all. So a little bit about Thrive in Your Workplace for those of you who don't know us. So we are a public-private partnerships that helps local employers integrate mental health supports into the workplace. So we've been working for the past year with a variety of employers across New York City and many with global locations to really help them look at what they're doing with their staff and think about how they can really promote mental health in the workplace. And we provide assistance with doing assessments and providing customized workplace mental health strategies. And since the outbreak of the pandemic, we've tailored a lot of our work to really look at what is going on right now and how can we set up systems in place to support people right now with this very acute need, but also looking forward in the long term and thinking about what are the kinds of system change that we would like to see. So for today's facilitators, we'll introduce ourselves. So my name is Rachel. I've worked with Thrive in a Workplace for a little over a year, and my background is really in quality improvement, and I've worked for the government of New York City for a long time, most recently at New York City Health and Hospitals. And I'm thrilled to partner with Dr. Nicole Andreoli, who has come here to assist us with developing this material and really providing a clinical perspective. Dr. Andreoli, would you like to say a few words to introduce yourself?
Sure. Hi, everyone. I'm Dr. Nicole Andreoli. I am a clinical psychologist. I work in Midtown Manhattan in group practice. My background and education and experience is both with individuals as well as organizations. I have training in organizational psychology as well. I'm very excited to be here today.
Thank you so much. Very excited to have been working with you on this very quickly, actually, together. So today, we're going to be talking about the impact of COVID-19 on workplace mental health. And we're going to be looking at that from a couple of different levels, from how it impacts us as individuals to really looking at organizations at large. And then Dr. Andreoli is going to really help us look at recognizing some signs and symptoms of mental health challenges and what that means right now when we're all really experiencing a lot of stress and anxiety, and what we should really be looking for to think about what we need to do right now and when it's time to really reach out and get some support. And we'll also provide some information about resources to give that support. Then she's going to lead us through some tips about managing our stress and anxiety and thinking about our thinking patterns and how we can review that work. And then I'm going to talk a little bit about my own perspective about bringing mindfulness into the workplace and some strategies, and also how organizations can support mental health in their workplaces virtually right now. And then we'll have some time for Q&A at the end of the training. But so to get us started, I think it's, a real understatement to say that we are living in uncertain times. News changes daily. I had to update these statistics pretty much every time I updated this presentation. And, as we see signs of the world reopening and changes for the better, but there's no denying that this is one of the most difficult points in history that probably any of us will live through. And as New Yorkers and elsewhere in the world, but we've really borne the brunt of this crisis and seen its impact on our friends and families and workplaces. And while we are all doing our best to flatten the curve by social distancing and wearing masks right now, these numbers are really staggering. So many confirmed cases, unemployment, and the general economic uncertainty, which obviously has a great impact on the workplace, and a general feeling of hopelessness and worry about the future that is ever present in our lives. So there's a lot of uncertainty right now, and humans were not built for this uncertainty. And as we were developing this training, we really wanted to look at how we can help folks right now with the information they have, which changes daily, and we're constantly wondering what the next steps are, and that we're really forced to live with this uncertainty right now as we figure out how to move forward. So while we cannot solve all these problems, we're really hoping that we can talk today about what we're seeing and provide some strategies for moving forward with what we're experiencing right now. So looking at the impact of COVID-19 on the employee experience, there's been a couple of studies that have been done really quickly to see how this is so different right now. You know, I know for myself, this is the first time that I have ever worked from home for a long period of time. And that, you know, brings with itself a lot of challenges, especially when it was so sudden. You know, Thursday you were in the office and Friday they told you to go home at 3 o'clock. So 70% of workers have reported feeling more stressed out right now than at any other time in their professional lives. A lot of employees working from home report higher levels of stress. You know, this can be related to having childcare, you know, taking care of other adults who are living in the home, and just in general, this huge shift that we're experiencing. And even 43% of employees have reported becoming physically ill as a result of this work-related stress. So, you know, we can see that this is really having a great individual impact on us and, you know, our abilities to be present in the workplace and be present right now at this challenging time in our lives. So in addition to the great individual suffering that really happens, you know, there was a lot of impact on the workplace and on, you know, our ability to do the work that we need to do, where right now for many of us, there's a great fear about losing our jobs versus there's a lot of work that still needs to be done, even in these really challenging times. So we're also seeing a really big impact in, you know, reduced productivity related to COVID-related stress. And, you know, a lot of workers agree that their employees at their company are significantly less productive because of this stress and anxiety. And we're seeing that a lot of this is related to mental health challenges as a result of some healthcare providers who work with these employers reporting really high numbers of folks who are reaching out and accessing these mental health services that previously they were not. COVID has really radically changed how we live and work. But right now, employers and employees, for those of us working in these places, we really have a critical opportunity to support employee mental health during this time. The impact of COVID-19 influences all levels of organizations, from individuals with the increases in stress and anxieties that we just talked about, for managers and leadership with constantly shifting priorities and information from the city, state, and federal level, the transition to managing a team remotely, and also the increase of challenging team dynamics, which I think we're really seeing with this shift to remote work and trying to figure out how this all works in our workplaces. For employers overall, the economic uncertainty about the future is really covering a lot of the different work that they're seeing and, you know, how they think about the future. Who do they have now and where do they have that work? And I know I've spoken to some of you on the call before in various organizations, and this is really frontline and center for many organizational leaders. But there is an opportunity right now to look at putting these changes in place, and a lot of the changes that employers put in place right now to support mental health are really going to last beyond this initial pandemic effort. You know, I think we're really going to see these programs and meditation programs and working from home and types of supports as hopefully maintaining after this initial shock period to change how we work. So I know I've just given a lot of information that can be really challenging, and many of you already know a lot of this hard work that we're doing. But the good news is there's a great deal that we can do to support ourselves as individuals at work and also as an organization to support our employees. We can work to grow our resilience, increasing our capacity to weather and grow from these adverse experiences. But first, we must work to understand what is happening at this current very difficult moment and what this stress looks like in our minds, bodies, and actions. So Dr. Andreoli is going to start us off by unpacking some of the different types of responses people may be having to this crisis and how to know if you or a loved one or colleague should seek out some additional help at the time. So once we learn what it is that we're experiencing, we'll start to talk about the important concept of acceptance during uncertain times and some strategies we can use to implement this important concept. But first, let's start at the beginning and begin to unpack what some of these statistics mean in terms of mental health. I will turn it over to Dr. Andreoli to walk us through some of the common symptoms and signs of these mental health challenges.
Okay, thank you, Rachel. So I do want to start with what are general signs of emotional distress. When we talk about stress and anxiety, what does that even look like? And at what point do those symptoms become indicative that you should ask for help? So the first thing I want to emphasize here is that Negative emotions, particularly anxiety and sadness, are healthy and normal. And there are lots of instances when you should feel bad, right? Anxiety is an emotion that's a normal reaction to certain situations. And to be honest, it serves a useful purpose. And usually that's to protect you or warn you or let you know that there's the potential of some sort of danger. So, to give a dramatic example, imagine you walk out of your office building on Fifth Avenue and you see a lion walking towards you. You would immediately feel fear, and which is an extreme form of anxiety, and you should. If you see a lion walking down Fifth Avenue, you should feel afraid. Now, more commonplace examples of stress or anxiety would be things like maybe a meeting with your boss the night before an interview, taking a meeting while your baby is sleeping, all the while hoping that the baby doesn't wake up. Common examples of symptoms related to those experiences are what's included here on this slide. And I want to make a note here that sadness works the same way. At one time or another, everyone will experience feelings of sadness or grief or loss or loneliness. And while sadness in response to a trigger, which is typically some sort of loss, is completely normal, depression is the more intense form of sadness, just how anxiety is the more intense form of stress. And these emotions become abnormal when they start to interfere with daily functioning. So the symptoms here can be indicative of both anxiety and depression. And if we go to the next slide, here we can start to see where some of the symptoms of anxiety and depression start to make a shift towards being abnormal, and when seeking help would be ideal. So typical signs that stress or sadness have reached this point would include changes in the duration, the intensity, and the frequency of the symptoms. So they both become abnormal when the symptoms are chronic, when they interfere with functioning and well-being, so those social and occupational areas of life. And so that's when you really would want to kind of take note of those warning signs and start to think about what would the next steps be if I needed help, right? If my symptoms are interfering with daily functioning. Okay, next slide. So now that we've identified what mental health is and what the signs and symptoms are, the next step is how we care for our mental health. And I want to take a few minutes here to talk about strategies for managing stress and promoting our well-being. So a recurring conversation that I find myself having with most patients, regardless of what their symptoms are and level of severity, is making sure that they have what I like to call the mental health trifecta. And while this is always important, during a time of global pandemic, these things are even more important for maintaining our mental health. The first step here is a good support system of friends and family. And that's especially in times of social distancing when we really have to make an extra effort to be social. The second component is going to be an exercise regimen, and this includes all aspects of body movement, an exercise routine, stretching, daily steps. This is anything that gets you up and moving. The third component is an overall routine. So this is healthy sleep patterns, good eating habits, hobbies and activities that you enjoy. And now during quarantine, this is also how are you structuring your day? So fitting in work responsibilities, homeschooling, and taking care of other family members. So I add a fourth tenet to this, and that is a good internet connection and access to websites or apps on a phone or a computer. There are a slew of websites and apps that can be used to help encourage, improve, and maintain mental health and overall help in your mental health accountability. There's apps that can help with coping strategies, tracking thoughts and emotions, meditation, mindfulness, simply reminding us to take a pause and take a deep breath, and even some that can help as a tool to facilitate therapy sessions. And anyone can benefit from these. These are for people that are in a good place and just like to stay accountable for staying in that good place, people who are just having a bad day or going through a rough patch, and any level really of emotional symptoms, whether they're at a subclinical or clinical level. I really like Headspace and Calm. They're two of my favorites for meditation and mindfulness, but there are plenty out there, and really, everyone's needs here are unique. So finding something that works for you is always going to be the right fit. Next slide. So, in thinking about emotions and how to cope with negative emotions, there are 3 steps that I think are really important. That's acknowledging negative emotions, focusing on what is within your control, and acceptance. So, the first being acknowledging negative emotions. I stress this one because typically when we feel negative emotions, most of us want to avoid it. We don't want to feel the pain. We don't want to feel the worry. Our knee jerk response is often to just do what we have to make it go away, right? It's painful to be in pain. But it's important to remember that no one wants to feel anxious or sad, but we have to. It's healthy to. In fact, avoiding the emotions is unhealthy. When we avoid an emotion because it's too overwhelming or painful, that additional stress on the mind and the body creates even more distress and even more symptoms. And this is often where you start to see physical symptoms creep up. At the lower end, that might just be headaches, stomach issues, sleeping problems. But at the more extreme, that could be heart disease and autoimmune disorders. From a workplace perspective or even an academic perspective, you may start to experience problems with focus, concentration, staying on task, and procrastinating. So it's really important to acknowledge that you're feeling the negative emotion. You wouldn't even engage in it by saying, I'm feeling really anxious right now. Admit that you're scared or sad or even panicking. You want to make sure that you're not trying to convince yourself that your anxiety isn't real or trying to ignore it. Most importantly, avoiding the emotion doesn't make the trigger go away. So you can force yourself right now to avoid feeling anxious and scared, but that doesn't do anything about the threat of catching COVID-19, right? The threat of potentially contracting the illness doesn't go away because you're ignoring how scared you are about it. So acknowledge and observe the anxious thoughts and feelings without trying to ignore, fight, or control them, and instead simply just make note of them and acknowledge them without judging it. A good way to do that is this strategy to just roll with it. And roll here stands for recognize, observe, and let go. When you recognize the emotion, you want to just acknowledge it for what it is, a thought, nothing more, nothing less. Our thoughts are powerless. They don't predict the future. They don't guarantee a particular outcome. So you just want to recognize the thought. I'm having a thought that I might get really sick from COVID. The second step here is to observe the thought. Notice it and how it's impacting your body and your feelings, and just kind of allow it to be. Don't judge it, don't react to it, don't fight against it. So I can notice that this thought that I might get really sick from COVID, that's me predicting the worst here. This makes me nervous. My stomach kind of feels tense. I have the urge to avoid going out by myself so I can feel safer. But instead of reacting to this thought, I'm just going to let it be and kind of let it sit for a while. And that's the last step. Let it be and then let it go. And after you observe the thought, it might be helpful to actually visualize letting it go. And this is where visualizations can be really helpful. You can imagine clouds floating in the sky and your thought being one of them. So the thought kind of floats in, maybe it changes shape and disappears, and you can just watch it float past you. Your thought can be a leaf flowing down a stream. It comes into your fields of view, but you don't have to reach out and pick it out of the stream. You just let it kind of continue to flow, and eventually it flows out of sight. So we've acknowledged the emotion here. The next step here is to focus on control. What part of the situation is within your control? Knowing the difference between what you can control and the things that you can't is probably something I spend a large part of most of my days talking about. And the point here to stress is that you can't control the outcome of a situation. You can only control your response to it. So I can control how I show up in my relationships, but I can't control what other people think of me. I can control how much time and effort I put into preparing for a job interview, but I can't control whether I end up getting the job. A lot of us get stuck because we focus on things that are outside of our control. And in fact, when we're feeling anxious or depressed, a lot of the suffering comes from trying to control what we have no control over. So something to consider. What is the point of focusing on things that you cannot control? If you have no control over it, you can't change it. You can't prevent it from happening. And a really big one here is that worrying about something that you do not have control over doesn't actually make you more prepared for it if it does happen. And I see this with a lot of my patients. They hold on to this idea that if they worry about something, when it happens, they'll be more prepared for it, and so it'll be less painful. And if you take a second to think back to any negative event that has ever happened to you, I'm sure you can very easily conclude that that is actually not true. No amount of worrying makes the event less painful when it actually happens. So what we're doing here is prolonging your suffering over something that may not actually happen, right? We can't predict the future. So things that we can't control, how others judge or perceive us, what happens in the past, what's happened in the past, or what may happen in the future, losses in life, the inevitability of aging, illness, or injury. What we can control, though, is how we respond, right? How do we respond to our thoughts, to our feelings, the actions we take towards our goals, how much we focus on and engage in what we do, how we respond to loss as it occurs, and how we respond when life doesn't give us what we want. So if you've lost your job or income during this difficult time, right, that's something that's out of your control. You still have control over how much energy you put into searching online for work, sending out resumes, networking with your contacts. In the same vein, if you're worried about your health amid the coronavirus pandemic, that's out of your control, but you can control the actions you take by regularly washing your hands, cleaning surfaces, avoiding crowds, that type of thing. So the last step here then is acceptance. And when we're talking about emotional acceptance, we're talking about the willingness and ability to accept and experience a negative emotion. Acceptance allows us to accept the reality of the situation. It's less emotionally taxing because we're not spending extra energy trying to push the emotion away. When we accept an emotion, we're giving ourselves a chance to learn about it, to become familiar with it, to become skilled in its management, and to integrate it into our life. Avoidance doesn't teach us that because you can't learn to do something by not doing it. Finally, here with acceptance, when you accept the negative emotion, it tends to lose its destructive power and the hold that the negative emotion has over us. This is really surprising and counterintuitive to most people, but if you really think about it for a minute, you can understand the logic of this approach. And I want to paint a little picture for you here to really drive home this point that I'm trying to make with accepting emotions. So think about swimmers. When swimmers are caught in an undertow, they feel themselves being dragged out to sea. They often panic and begin to swim against the current with all of their might, using all of their energy. Oftentimes when that happens, they fatigue, they cramp, and then they drown. To survive, swimmers are actually taught in those moments to do the opposite and to let go. Let the current take them out to sea. Within a few hundred yards, the current will weaken, and the swimmer can then start to swim and get back to shore. The same is true with powerful emotions. Pushing against it is futile and possibly dangerous. But if you accept the emotion, it may peak, but like the current, the height of it will pass, and you'll be taking the power away from it. Next slide. Okay. So the field of cognitive behavioral therapy focuses on how our thoughts, feelings, and behaviors form a cyclical pattern, like this diagram is showing. For example, if you're scrolling your social media feed and you're thinking, everyone is so productive during quarantine, I'm so lazy and worthless. How does that make you feel? The emotions that that's going to trigger for you are probably sadness, frustration, maybe shamefulness. How does that then cause you to behave? Now you've probably lost all of your energy, all of your motivation. Maybe now you're taking an extra long nap, staying in bed most of the day, overeating, maybe even drinking too much. After that, how do you now feel? What kind of thoughts are you having now? This cycle becomes repetitive. But the first step here is to be aware of the type of negative thought patterns that you're experiencing. On the next slide, I'm going to show you some of the more common ones. So these are types of negative thought patterns, which we would call cognitive distortions. And they're important because we tend to think in patterns. Our brains have automatic ways of appraising a situation, like a habitual way of thinking. But then again, those thought patterns are going to influence the emotions that become triggered. So all or nothing thinking, which is black and white thinking, is a big one. This is failing to see alternative options, failing to see the gray area. If I go outside, I will get COVID-19. I've missed so many activities and events because of quarantine. My life is over. There's no middle ground, no alternative outcome. It only considers 100% of the bleak worst case scenario only outcomes. Catastrophizing. This is imagining the worst case scenario as the only possible outcome and accepting that it is true and that is going to happen. The world is never going to go back to normal. I'm never going to be able to see my friends. We're all going to get coronavirus. I got bad feedback on a project. I'm going to get fired. My life is over. I'm not a good teacher to my kids. I'm ruining their lives. Mind reading is imagining we know what others are thinking, and I know we're all guilty of this one. But common thoughts here would be, I logged onto a Zoom meeting a few minutes late. Everyone thinks I'm irresponsible. Passing an old friend in the grocery store. They don't say hello and you think, they must not like me anymore. The last one here is labeling, and this is something else that everyone does without even being consciously aware of it, right? Being frustrated that you can't figure out fourth grade math to help your kids and thinking, I'm stupid. I'm not baking or learning a new skill while in quarantine. I must be lazy. So let's go to the next slide. So now that we're working on developing an awareness of the kinds of thought patterns that we have, the next step is how to correct it, right? What do we do with this awareness? We want to eliminate the power that those thought patterns have over our subsequent emotions and behaviors. Reframing is a good strategy. This one forces us to take a look at situations from a slightly different perspective. So instead of thinking I am stuck inside, we're thinking I can finally focus on my home and myself. Instead of thinking, what if we're in quarantine for another month? We change that thought to, even if we're in quarantine for another month, we'll get through it. Instead of thinking, I'm horrible at working from home, we change the thought to, I'm gaining a better understanding of patterns that get in my way so that I can be more effective. A common one, my family is driving me nuts. We can change that to, we can reframe it to, we're all struggling. We're learning lessons about our own triggers, or I need to learn how to ask for what I need, such as a break or a time alone. The next thing that you can do to manage negative thoughts is challenge the thought. I like to ask myself questions that challenges the validity of this thought that I'm assuming is 100% true, right? What is the evidence that this thought is true? What is another possible explanation? If I'm thinking, my friends haven't tried to have a Zoom call with me, they really don't care about me. Maybe I can challenge that by asking myself, what's another explanation for why we're not having Zoom calls? Maybe my friends are tired from juggling work and family life. Maybe they're experiencing their own anxiety. If the thought is something like, the world is never going to get back to normal, what's another possibility there? Maybe things will be different, but there will still be a sense of normalcy in the new normal. If I go outside, I will get coronavirus. What's another possibility? You can go outside and not get coronavirus. So there's a chance that all of us will get coronavirus or any other illness. And there's a chance that we can all lose our jobs. In thinking this way, managing these thoughts, we're not trying to sugarcoat or deny these possibilities. We're just trying to manage the anxiety that these thoughts trigger. We want to acknowledge that these thoughts are possible, control what we can to prevent those things from happening, and accept that the possibility here is scary. However, we don't want to prolong our suffering. There's no reason to be highly anxious now about something that has not yet happened. So the last thing I will leave you with today is the thought challenge. What do I know is true right now? Right now, I know that I'm not sick. Right now, I feel healthy. Right now, I have a job. Right now, my kids are happy. Right now, I'm surviving. Right now, I'm doing the best that I can. So the point here is to force yourself to focus on that present moment, right? And you could ask yourself this question, what do I know is true right now, hourly, throughout the day, if you needed to check yourself, to make sure that your thoughts aren't getting ahead of you. You want to force yourself to focus on the present, acknowledge what is actually happening as a way of not prolonging the future by worrying about things that may or may not happen.
Thank you so much, Nicole. I really appreciate that. And so now we're going to talk about a very related, but a slightly different strategy to really look at how we can work with this uncertainty and accept it. And that's practicing mindfulness. So there's a lot of talk about mindfulness that doesn't sort of definitions or concrete, okay, that sounds great, but how do I actually do this? So we're going to walk you through some strategies that really talk about what exactly this is and how we can try to practice this in our daily lives and also really in our work lives. And this quote and definition of mindfulness: the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. It's from Jon Kabat-Zinn, who is one of the preeminent meditation teachers and created mindfulness-based stress reduction therapy, which is a really famous evidence-based tool that really looks at how we can use mindfulness to work through our lives and reduce our stress. So again, let's unpack this a little bit. What are some of these key elements of mindfulness? And how is this helpful right now? So mindfulness can help us notice our anxiety, which is generally sort of a bad time to make a lot of decisions, and help distinguish between reasonable fear and extra anxiety produced from the mind. And it can also help us face the current situation with COVID and this uncertainty, instead of trying to push away painful thoughts or really wishing that things weren't the way that they were or otherwise. Using mindfulness can help to build resilience and calm and compassion and awareness to help us do the best we can in this really challenging current situation. So key elements of practicing mindfulness include being conscious of your current experience, so aware of each action you're taking. So an example of not being conscious is when you're going to drive to like pick your kid up from school and you realize you're driving to the grocery store, just totally lost in thought. Focusing your mind on the present, not the past or future. So if we look at our thoughts critically, a lot of the time we'll realize that we're either headed for the future or sort of beating ourselves up over something in the past. And it's really hard right now to really stay in that present moment. And I think with COVID, our future is very uncertain. We don't know exactly what this will happen. And so we can have a tendency to really have a lot of anxious feelings about that, which is normal. I don't know that mindfulness will take that away, but it can help us to try to really focus on the present right now and do what we can. And as Dr. Andreoli said, control what we can. And allowing your experience to occur as it is, not good or bad, but just what it is. So this again goes back to not judging yourself for what you're feeling, but just accepting it and thinking about how to move forward. So there's a robust array of evidence that has shown that mindfulness is a really helpful tool, and it can improve our mood and positive emotions. It helps to decrease our anxiety and burnout, and has even been shown to improve physical health outcomes. So it's a really incredible tool. I know I've been trying to practice, and that's what they call mindfulness. It's a practice with meditation and other tools. But I'm certainly not an expert, but I can say that it really definitely helps try to approach the challenges that we're facing right now. So before I talk about using RAIN to manage stress and anxiety, I wanted to go back to this idea about why we're talking about mindfulness and cognitive behavioral therapies. Dr. Jack Kornfield, who is a very famous meditation teacher, has said that Buddhists were the first cognitive behavioral therapists. So Dr. Andreoli, I'm wondering if you could talk a little bit about how these are related and how these concepts work together.
Absolutely. Anxiety by definition means that we're focusing on things that have already happened in the past or have not yet happened or may happen in the future. And both CBT and mindfulness, they take different but related approaches to staying focused on the present moment and paying attention to only what is happening. So there's a lot of overlap between the two fields because of that.
Thank you so much. And I think you'll see as I walk you through some of these steps using the RAIN mnemonic device that they really cover a lot of what Dr. Andreoli just walked us through. So the acronym RAIN is a helpful mnemonic for guiding a mindfulness practice and really putting together a lot of the tips that we talked about. And I think it can be really helpful for guiding us through the moments where we're really experiencing something very negative. And it was developed by Dr. Tara Brach, who is a psychologist and also a Buddhist meditation teacher. So R stands for recognize what is going on. And so this is sometimes referred to as the magic moment, and it means consciously acknowledging the thoughts and feelings and behaviors that are affecting us. And so it's noticing in that moment that you're feeling really burned out or feeling really anxious. So the way I think of it is, when we're caught up in the moment, it's really hard to know what's going on or what we're experiencing. But for me, it's when I'm about to, someone sends me an email that I think is rude or is asking me to do something I don't want to do, and I'm getting ready on my keyboard to send them a really nasty email back. Moment where I'm like, oh, I'm upset. And sometimes I can stop myself from sending that email. Sometimes I I don't, and I have to work on that. But I think it's really that moment of recognizing, oh, something is happening right now, and sort of coming out of it to take a moment to practice mindfulness and see what's really going on within ourselves. So once you've recognized what's happening, that sort of magic moment, you want to allow the experience to be there just as it is. So this means letting thoughts, emotions, feelings, or sensations just simply be there without trying to fix or avoid them. And, again, I'll say about every step in this practice. It's easier said than done. But, one thing I've heard a lot from folks when we're talking about what's going on right now in COVID, and they might be experiencing some depression or burnout, is that they really pile on themselves for experiencing that feeling. Why aren't I, being burned out? I should be grateful to have a job. What is wrong with me? So while they're already suffering, they add on this level of sort of castigating themselves. And so, allowing the experience to be there really says, I'm not going to say that right now. I'm not going to say this is good or bad, but I'm just going to feel whatever this feeling or experience is. So then you want to investigate with kindness. So now we want to explore this feeling, but in a non-judgmental way. So this is not where we decide, oh, these are good or bad feelings, but it's really what's happening. And I think it can be really helpful to center this investigation in the body. How am I feeling? Is my chest getting tight? Am I clenching my fists? Is my breathing getting really shallow? Start out really looking at a lot of these physical sensations, and then explore, what is going on in your mind? Am I worried I'm going to be fired? Is that sort of what's driving me to send this, really rude email to someone that I don't really need to send? Or, am I feeling underappreciated, that I've been, working 12-hour days and no one is appreciating me and they're still hassling me about the one thing I didn't do? So start out with the physical, and then you can look at your emotions and think about, okay, like what is really going on here? And then finally, you want to nurture yourself. You want to nurture yourself with self-compassion, which again, not judging the experience, allowing it to be what is, and thinking about what you need in that moment. Whether it's a meditation, it's stepping outside, it's holding pause on sending that email before you really want to let that other person know what you think about, and thinking about what you need in this moment. I think most of us don't want to be those people who are sending those nasty emails. And so this can really be a helpful tool to sort of take a moment, figure out what's going on, and treat yourself with some kindness about this experience. Dr. Jack Kornfield again says, if your compassion does not include yourself, it is incomplete. And I think for many of the folks who are on here who might be in leadership positions or working with teams, that's something that's really important to remember. You cannot solve the global pandemic crisis right now for your team and all of the myriad issues that are coming. But the only way that you're going to be able to provide the support and guidance they need right now is by really starting practicing compassion for yourself. So now we've talked a lot about some individual strategies that we can use to help manage some of this stress and anxiety, but our behavior doesn't occur in a vacuum. We're all part of organizations and systems and families. And so we wanted to take a little bit of time to really talk about what some of the stressors and sources are that are occurring in organizations and how leaders can really support themselves and support their communities and organizations. And so Alex Gorley and Betsy Schwartz are some researchers who focus on workplaces and have said about the recent COVID condition, regardless of where the various stressors and sources may lie, the call for help needs to start with employers to provide the programs, services, education, and training necessary to demonstrate that employees being their single isn't just a cliche. This is a lot of the types of work that we focus on with Thrive on Your Workplace when we're working with employers, both looking at individual employees, but how are the systems that we're setting up in place to support everyone? So here are some organizational approaches to promote mental health in the workplace. Starting out, I use this word a lot, but leading with compassion and model supportive workplace behavior that you really want to be able to see in your colleagues. Change comes from the top, and employees will take leadership behavior and communication as setting the norms for this new situation. Leaders can lead compassionately by providing flexible scheduling for people who may have children at home or caregiving responsibilities, and model good work-life balance by not sending emails after work hours or logging out at the end of the day. In times like this of great transition, it can also help to over-communicate. For instance, even if you do not know when people will return to the office, merely saying, "We don't know when this is going to happen," can help to mitigate some of that anxiety. Another tool is to create opportunities for social support, which I know many folks have been doing really exciting ideas lately, from discussion groups for movies to talent shows to really setting up sort of virtual happy hours for folks. But right now, when we're all at home, it's really helpful to try to keep up some of those social connections that people have in the office, where they may not be getting that in other areas of their lives. In addition to promote mental health specifically, there are a couple of resources that can be really helpful. One is engaging peer champions, so identifying folks who are really passionate about this cause and know a lot about the resources that are available and the importance, and can share that with their other employees. Or setting up employee resource groups. Some are mental health focused, really talking about what the mental health needs are of employees and how leadership can help support those. But I think any type of affinity group can be a great place to get social support. Another tip is to provide managers and staff with training to identify individuals who may be struggling, to supportively discuss mental health and help them access resources. Managers are really the front lines for this, that if employees are having a challenge, they're going to go to their line manager first. And also managers are in a position to really see through their team what's going on, who's not calling into meetings, who they haven't heard from in a while. Thrive in Your Workplace offers a free training for managers about how to talk to employees about mental health on our website that all of you can access to. And I think it's a great resource to start out thinking about these conversations, which can be even more difficult right now in some ways, just since we aren't seeing folks. So it can be a little harder to identify what's going on. And finally, organizations should provide lots of information about the benefits, such as the EAP program or insurance coverage. There have been a variety of changes recently, reducing copays. Many employee assistance programs and other places have added additional outpatient mental health and telemedicine coverage during COVID. So I think it's really important to make sure that folks know about what those resources are and how to access them. So now we have some time for some question and answer. We've already received a few of the questions, so I will be looking in the chat, but please use the chat function to answer some of these questions, and we will make these slides available to you after the session. So I will take a moment, but yes, please share your questions. So I will start out while folks are writing in some of their questions with the first question. So what about employees who are feeling a sense of imposter syndrome due to the uncertainty of their job progress, due to the diversion of attention to more pressing issues and/or the new workplace dynamic that can cause employees to be unsure of how well they're doing because they're working online? This is a great question. So I'll start out, and then Dr. Andreoli, if you have anything to add, please let me know. So I think, working from home has a lot of challenges. And I think one of the biggest challenges can be what we call role confusion or role ambiguity. What we're supposed to be doing, who we're supposed to be listening to, and how we're working right now has all changed. And understandably, there's going to be some shift in priorities. But I think there are ways to mitigate that for individuals using some of the strategies we've talked about. So first, being worried about your job and not being sure of what you can do. I think you can use some of the strategies that Dr. Andreoli talked about, some of those negative thought patterns. Am I catastrophizing? Am I using all black or white thinking? I'm either going to be fired or, I'm going to get a raise this year, to sort of use some of those thinking strategies. But then I also think there's some very pragmatic things you can do to address this by talking to your manager and asking, what are my most important responsibilities right now? Who should I be working with? Is there other resources or other ways I should be working right now that would be more helpful to the organization during this current time? I think that communication piece can go a long way in really addressing some of the uncertainty about what we're doing. Dr. Andreoli, do you have anything to add?
I think really just acknowledging the feelings of imposter syndrome here are really important. I think this is also coming up in a lot of different ways for a lot of people. And so I think acknowledging it and being open to talking about it is especially important. I think understanding what's a feeling versus what the reality is also a good way of kind of thinking through it. Feeling like an imposter is very different from actually not being skilled or adequate at your job. And I think sometimes if you can spread the thought out that way and really understand the difference between what you're feeling versus what the reality is in a situation, that can also help with some of those false beliefs.
Great. Thank you. We've had some other questions come in through the chat, and I want to encourage other folks as well. So this question, this is a good one. How should managers handle a situation where staff person A shares concerns about staff person B with a manager, but is concerned about staff person B feeling like they shared with A in confidence? Did everyone get that? I think, this is really asking if two colleagues, someone shares concerns with a colleague or peer about some mental health challenges they're having, and that person goes to tell their manager and they feel, betrayed, or that, that staff person really, that they were telling that to that person in confidence. So yes, thank you, Yvonne. Dr. Andrioli, do you have any suggestions to start this out?
So I guess we're asking, how do we maintain, is it maintaining confidentiality in the workplace, right? Or making sure that we're expressing concerns about someone else's mental health while, I'm just reading the question again. About how to get the staff person help. This is a really difficult situation because while you want to be helpful, the person who needs the help may be very sensitive about it, right? There's additional emotions that may be coming up related to being identified as someone who needs mental health assistance. There's still, unfortunately, are a lot of stigmas around mental health. And I think that especially in the workplace, this is one where that could really become a factor. And I think the way to progress here is really because I'm assuming the manager would have to take action, right? And I think that it comes from a place of a lot of I statements for the manager. I feel like, or I'm worried, I'm concerned, where the manager is kind of taking the onus for it. I just want to help. These are the things that I want to recommend, could be very beneficial to you. Is there anything that you need that I can do? And kind of keeping that initial, what do we call them, person A, keeping person A kind of removed from the conversation. So it really should come on the manager to take responsibility for highlighting this concern to staff person B, and again, using the I statements and really watching the language that they use so that they could work around any stigmas that the person may be holding on to. Because remember, outside of whatever anxiety or sadness or depression, whatever it is that they're feeling, there may also be embarrassment or shame, which may present itself as in an angry way or in some other way. And so making sure that the manager is taking ownership and watching the language used, I think, is the best way to kind of attack that head on.
Yeah, I think I agree. I also would add on, there are sort of different levels. If, as always, if you're worried that someone's going to hurt themselves or others, you need to go to your manager and they will need to, take more action. I also think reaching out to an employee assistance program. Some of the things that we've heard from other employers is that someone will come to them that they think another employee has a challenge, and they've reached out to their a mental health challenge. They've reached out to their EAP, and the EAP has really been helpful guiding them with what is appropriate to say, what are those resources, and how can they have that conversation. So I'd also really look at what resources you have. Okay, so I'm going to go on to another question, which is about leadership. So do you all have suggestions on managing up to a leadership team that isn't recognizing additional stress? For instance, cyber policing or meeting overload that they're placing on staff. I guess the first thing I would say is you can to thrive in your workplace, and we can try to help them really think about the mental health of their team and work through that. But other than that, I think this goes back to what can we control and what we can't control. And also, as much as you can, trying to set those boundaries. I think right now, some folks may not realize the meeting overload piece, and that can be really challenging. For instance, on our team, we started out originally having like sort of 2 daily check-ins, and I think everyone realized that this, isn't helpful or working. So perhaps as we go on, those will decrease. And also, try to talk to your manager about that and see if there are ways that you can identify pre-existing meeting times that are sort of always on the calendar for everyone, to try to avoid what I've seen happening, which is a lot of sort of last minute meetings thrown on your calendar, which can really throw you off. All right. I think we have time for a few more questions. Okay, so another question is about, I think we're getting into sort of the longer term performance challenges. So what if you're providing a lot of support to a staff for mental health challenges and their well-being, but a certain staff member is just continuing to not acknowledge their tone and emotions or take advantage of our support? So I think this is something that we're actually hearing a lot from different organizations. And this is as we're all working from home for longer periods of time. The issues are becoming more about performance management. We've gotten over this initial shock. For the most part, we figured out how to, have access through our VPNs to our computers. And now folks are seeing some of these performance issues. So I think it's really important to delineate between what is a performance issue and what is a mental health challenge. I think they can be related, but we can all encourage others to get support for their mental health challenges. That's really on them. But if someone is behaving inappropriately in meetings with tone, if someone is not getting their work in on time, those are really work related issues. And so I think focusing on the work as opposed to that mental health challenge can help guide those conversations going forward. But as I say that, I think that's really challenging, and this performance management issue is something that folks are really working on a lot. All right, so I think we have time for one more question. So this person wrote, in my community, it is difficult to get managers or administration to understand the importance of mental health for employees. Do you have any advice on training or encouraging managers to understanding the importance of mental health in the workplace? Leadership is rarely trained to differentiate a difficult employee from a struggling employee. I think that's absolutely true. And Dr. Andreoli, I know you've done some work in other areas about this. And do you want to talk a little bit about this?
Yeah, I want to say first and foremost that it makes me really sad and borderline angry to hear that that's still the case. But what I usually suggest in experiences like this is, we want to make a push to organizations to incorporate mental health, and that's at training at all levels of the organization. So if you're not getting the buy-in from the managers in that upper level organization, my best advice is to point to the research. Usually upper level management is responsive to numbers and statistics and how mental health affects not just things like the morale of employees and satisfaction and motivation, right? Because everyone at work is a team, even if they're not, necessarily working on the same project together. But there's also plenty of research out there that actually shows how mental health at work relates to engagement, it relates to loyalty, it helps reduce retention and turnover, which is very expensive for organizations, and it can really affect the bottom line. And so I think the easiest way to get buy-in from upper level management and superiors who aren't understanding the importance of it is to refer to numbers and statistics as much as possible. And they're readily available. They're really easy to find online. And I think that could really help to drive the point home of how important this is.
Thank you so much, Nicole. And that is actually a great segue into our final slides. So I think a lot of what we do as part of Thrive in Your Workplace is really talk to managers and leaders about the importance of workplace mental health and how we can help them incorporate this into their workplace. So I really suggest that you all visit our website. We have a lot of great free resources there, and we can also come and virtually speak to your workplace about some of their needs and think about how we can help them both in this sort of COVID specific mental health challenges, but also really looking forward. How do we build up that business case to show that workplace mental health is really important? And I think we are seeing a groundswell of support for that notion. So thank you all so much for joining us. We wanted to share a couple of resources that include some resources about where to get free help and social support for mental health, and also and challenges or apps and resources that you can look at that can really help you from home. So there's some meditation apps. Dr. Andrioli mentioned Headspace, which is currently free for New Yorkers. And there are a whole bunch of others that can help guide us through our practice. You can also reach out to Dr. Andrioli for additional support through her office. So finally, there is a short evaluation poll, which I'm putting out now. We would really appreciate it if you would all fill this out. We'll stay on for a few more minutes, but thank you all so much for participating from all over the world. We really appreciate it, from Australia to Puerto Rico to Brooklyn, right near my neighbor. Thank you. We will send out the slides to all of you, along with some additional information about Thrive in Your Workplace. So I'm launching the poll now. Please let us know, and let us know any additional feedback in the chat. And thank you all so much for being with us here today. We know it's a lot, and we appreciate you sharing your time with us. And thank you all for your lovely chat comments. This is the nicest chat group I've ever been a part of in any sort of training. Thank you all. This is so lovely. It's a really great way to start out my day.
Absolutely.
All right. Thank you all so much for participating. We really appreciate it. I'm going to end the meeting now. And everyone have a great day. Have a great long weekend. I hope we can all take some time to practice compassion for ourselves and get together with our loved ones.
Bye, everyone.
All right. Thanks so much, Nicole. I'm going to sign off, but I will talk to you soon.
Take care.